Hi, everyone. Welcome to my YouTube Live. We're just going to wait a few minutes to see who joins us. I am going to just adjust my camera just a little bit because I'm using my MacBook, so I just want to make sure it was okay. And let's see what we got going on here. I'm just going to share the link on my page. On my pages. If you're here, let me know. Say hi. Grab a drink, grab a snack. Grab a notepad, take some notes. Hope you guys are having a good day. And then we're going to get started shortly. Okay, so just to introduce myself a little bit, I'm just going to keep adding some links, some different places. My name is America, but my friends call me Erica. I am currently in my second semester of nursing school, and I am finished my fundamentals 3 weeks ago. I think it was 3 weeks ago. And I passed, thank God. I passed. And I am a mother. I have 3 children. And sorry, I'm all scattered. I'm looking everywhere for different things. I am also a wife, and I'm 35 years old, so I'm kind of on the older side as far as age is concerned, although my program does have lots of older students. So I'm not sure how it is at your school, but we do have a good mixture of students that are a little bit older, which is nice because then I don't feel so, weird about it or whatever. If you have any questions, go ahead and jot them down in the chat. I'm going to go ahead and enable live chat. All chats are open for questions. Okay, so my hair's a mess. What do you guys think of my shirt? Messy bun, coffee scrubs, hashtag student nurse. I love it. I just made it today. I'm probably going to wear this the first day of the semester. I also have this. If you guys are a nursing student now, you know exactly what this means. If not, then I suggest that you start learning your abbreviations for dosage, because this is vital. If you don't know what it means, obviously you know what caffeine means. Everyone knows what caffeine means. We have PO, which is by mouth, and then we have Q4H, which is every 4 hours, and PRN is as needed. Don't ask me why PRN is as needed. I have no clue. So if you have questions, go ahead and put them in the chat. I would love to answer your questions. I am in an ASN program. I will be bridging over to a BSN program once I do finish my ASN. So that is in the plans, of course. And I finished Nursing 1. Nursing 1, we don't have like separate classes in my program. We have Nursing 1 through 6, and all of it is included in one semester as one class. So we have a lecture, we have lab, and then we have clinicals, and of course we have skills. So in my nursing fundamentals, we did vital signs as a skill, we did catheter, we did head to toe assessment, and we also did med administration. So those were my 4 skills. I think that was it, all those skills. It seemed like so many because I was in the summer term and it was super, super busy because we lost several weeks because of the summer term. So it's just really, really crazy. But yeah, so that was my first semester. It was very difficult. I'm not going to lie. I am not a spring chicken anymore, so my brain does not work the same. I'm the type of person that I need to study for me to retain the knowledge. So it's very time consuming, and they say it's going to be time consuming. My program was a 3-day-a-week program. So we went to lecture on Monday, which didn't consist of lecture half the time. We went to lab, or we went to clinicals. No. We went to lecture Wednesday, which again didn't consist much of lecture. I'll explain later. And then we had lab on Thursday or clinical on Thursday. We had 4 clinicals where we were sent to a nursing home or a living facility or a rehab facility. And we had opportunity to work with a CNA, which in my experience, 3 out of the 4 CNAs that I work with were not very receptive to me being there. I felt like I was in the way. So that was kind of discouraging to, feel that way. But I did do what I could do to learn and ask questions and all that good stuff. So make sure you ask me questions, you guys. I'm here to answer all your questions. I did have to do all my prerequisites prior to applying to my program. I'm just looking through this here. Let me see. So like most of you, I did have to do like A&P 1 and 2, microbiology. I had to do all my core classes. I essentially got my AA or my AS first and then applied to the program. And I did have to take an entrance exam. For my school, I needed to take the TEAS exam. For some schools, it's the Kaplan, but they're similar. It's just a basic knowledge. It's, grammar, English. They want to make sure that you know how to read and write. Science, math, and then the English is 2 portions. So it's four sections altogether. I got a 78. I have my stuff around here somewhere. I gotta look for it. I think I got a 78. No. I got, 78. And my program we needed 64 in order to apply to that program. So my highest score was math, go figure, because I hate math, and doses calculations is like the death of me. But if you learn dimensional analysis, you'll be good to go. We'll talk about that too. Go ahead, ask me your questions. Any questions you guys have, go ahead and leave them in the live chat and I'll answer them. I do have several videos posted on my channel in regards to nursing school and how I deal. Sometimes it's really, really difficult. I have good days and bad days. I do suffer from anxiety. So I do have to find ways to manage my anxiety, which can be very difficult. And I'm finding that a lot of nursing students have this issue. I don't know if it's like a nursing trait that, you know, we have anxiety. I have no idea. But I personally have anxiety. So sometimes it works in my favor and drives me, and other times it just completely debilitates me. But we make it work. Okay, so questions, you guys. Please leave me questions. That's what I'm here for. Hey, would you be willing to elaborate as to CNA not being receptive to your clinicals? Fellow anxious person here. Okay, so I live in Central Florida, and a lot of our CNAs are of the Haitian race. So when you go into your fundamentals class, you're going to learn cultural differences and things like that. And I don't think they were just being mean or rude or anything like that. I don't think that was their intention. I think it's just a cultural thing where they like to work independently, and they're a little bit more on the quiet side. I think actually all 4 of my CNAs were Haitian. They were very nice, but I just felt like I was kind of like in the way. I would be asking them, like, what can I do to help you? And they would kind of just shoo me away to do something like not related to patient care, which I wanted to get my hands dirty and just like, you know, really be in the nitty gritty of patient care. So it could be a cultural thing. You'll learn more in cultural diversity and cultural considerations when you take your fundamentals class. As a matter of fact, I have my fundamentals book here, and there are several chapters on cultural diversity. And just based on culture and how someone's brought up is how they communicate and how they teach. And a lot of these facilities, these teaching facilities, they don't train their CNAs or their nurses how to be an educator. So it would be really beneficial if maybe they had like a program on how to like educate student nurses. I don't think that is really given to them as an option to help educate student nurses. So I'm actually going to bring that up and see if maybe, you know, my nursing program can develop a program where they can help these CNAs and LPNs like get into an educator role instead of just a caretaker role. And a lot of times these CNAs and LPNs and even RNs are, you know, they work alone a lot. So they're used to that. And, you know, you put 20 students in a facility all of a sudden, and then it's like, like, what am I supposed to do with all these students? So that's just my personal perspective on my clinical experience. My next clinical experience, I will be at a cancer center in the surgical floor. So I'm hoping to have a lot more patient interaction and actually connect with an RN. But I did enjoy working. I think it's gonna give me the ability to communicate better with my CNA when I am working as an RN or my LPN, because you need to learn to work collaboratively. And I think that's what the purpose of this clinical experience for Nursing 1 Fundamentals was all about, was collaborating and working as a team, and learning just the basic care skills like bed baths, toileting, all that stuff. So it says, hi, are there any students in your program? Hi, Vera, how are you? Yes, I actually have a lot of older students in my program. I'm 35. So a little back history on my educational background. I wanted to be a teacher. Don't ask me why, but I did. So I graduated high school, went into college right away, found out that I was pregnant with our first daughter, the end of first semester. Yeah, I think it was the end because I found out during finals. And I stopped going to school to raise my family. My husband continued going to school. He got his bachelor's degree in computer science. And I always said, I'm going to go back to school. I'm going to go back to school. And it never happened. And then my kids started growing. So I have a 16-year-old daughter. I have a 12-year-old daughter and a 10-year-old son. So I said, once they're in school, I'm going to go back. So that's what I did. So once my son was in 2nd grade, I think, I started doing my prereqs for all of my nursing, prereqs that we need to do. And I was even an older student then. So I started my prereqs in 2015, taking 1 or 2 classes here. And then I was admitted to the program last semester. So I was admitted for the summer term. And to my surprise, there are tons of older students. I would say the age ranges from like 19 to 45, maybe early 50s in my particular program. We do have 2 programs, well, actually 3. We have a concurrent program, which is ASN to BSN. We have an LPN accelerated to RN program, and then we have an ASN program, which is equivalent to ADN, where that's the program that I am in, and there's a day program and a night program. So I'm in the day program. It's a 3-day-a-week program. I chose to quit my job to focus on nursing because they tell you, if you are working, it can be really, really, really difficult to time manage, and be successful in the program. So I chose to, my husband and I, we chose collectively to, for me to quit my 40-hour-a-week job, full-time job in an accounting firm, for me to focus on nursing. So we did set ourselves up to be able to financially be able to manage with a family. And so that's how I'm doing it. Some students are doing it through student loans, which is, a lot of students are doing that. A lot of moms, a lot of single moms too. Let me see. 35 is still very young. You look younger than 35, but thanks, Rachel. Thank you so much. I take very good care of my skin. I drink lots of water. I love makeup, as you guys can see. At what point in the semester did you start using your stethoscope? We had to take all of our supplies, which I have with me. So if you guys want to see what's in my backpack, and if you want to see what's in my lab kit, I brought it here so that you guys can see. We started using our stethoscopes. We had to have it the first day of lab. So we had to have our stethoscope. We had to have our blood pressure cuff. We had to have our watch. And what else? Our lab kit, which I'll show you guys shortly. But we didn't really start using it probably until the 3rd week. But we had to have it. The first time that we started using it was for vitals, for blood pressure, and also for head-to-toe physical assessment. I have a video on my channel of the head-to-toe physical assessment if you guys want to see how I do my physical assessment. I'll try to link it below once this video is done. But get to know your stethoscope. Use it now. Put it on. Hear your kids' hearts and lungs, and just get to know the noises. You can also, maybe I'll do a how to do blood pressure type of video later in the future, tutorial, so that you guys can see how I do my blood pressures. Everyone has their little way of doing things. So my head to toe may be different from yours. And sometimes I change it up based on like how my patient is. If my patient is agitated, I'll move a little more quickly. If my patient is sleepy, I'll do things first that I can do while he's laying down and then get him up, things like that. Okay, so let's see. Hey, at what point in the semester did you start? Okay, so I answered that already. Did you use ATI Smart Prep? No, I did not use ATI Smart Prep. Are you talking about like the entrance exam stuff? For the T's, or are you talking about like, let me see, my school uses the HESI. So for my exit exam for fundamentals, we use the HESI. And they have like a HESI study, like test question bank that we could use. But no, I didn't use the ATI prep. I'll have to look more into that, I'm not sure. Okay, let's see. I'm from Minnesota. Do you think as a CNA you learn more working? Or I have worked over 3 years at assisted living because I wanted to get familiar with at least recognizing some months. I think working as a CNA or an LPN gives you great advantage. You are going to learn so much, just terminology, meds, what type of meds what they do. A lot of CNAs do basic care, and depending on what facility you're in, you may have like an LPN above you that does all the med administration, things like that. Each facility has their own different way of doing things. But from my perspective, CNAs did most of the basic care. So like toileting, bedpanning, changing, showering, feeding. things like that. They did not administer any medications as far as I'm aware of. But I think anything in the medical field, I don't have any medical experience whatsoever, so anything in the medical field will definitely benefit you. I chose to just go straight from my RN because I don't want to waste any time, and I'll learn as I go. That's kind of how I learn. I'm a visual learner. I learn by doing, so that's just my personal preference. But if you have experience, okay, so if you have experience, it's going to help you in the long run. But don't take that experience into nursing school, because the way that they're going to teach it is going to be different than the way that you actually do it. So while you're in nursing school, learn the way that they teach you or your book tells you. In my case, I have all my skills in this book. So I did all my skills based on how this book is. Now that I'm practicing these skills, I modify them to help me be more efficient. So I'm still doing the skill, I'm just doing it a little differently. You understand what I'm saying? And I hope that makes sense. Does your school use ATI, and how do you study for it? No, my school uses HESI. The way that I studied for the HESI was I just did practice question upon practice question upon practice question. I went to Quizlet. I reviewed everything that I was iffy on in my fundamentals book. There's a lot of skills on the HESI. We did use ATI-TEAS for the entrance exam, and I used a book called The Secrets to TEAS or something. I'll link it below. And I just really reviewed anything that I felt weak on. I studied for 1 week. I gave myself 1 week. I studied about 6 hours a day, and then I took it on a Friday. So I studied 4 days continuously and took it on Friday, and I passed my first time. Okay, let me see. Thank you. There are a lot of class presentations. Okay, class presentations, Naomi. Thanks for asking. Actually, my program had a lot of class presentations. We had three. The first one was a health fair. So we had to, we were assigned a topic to present at a health fair. So my topic, I think I have it here? I have a bookmark. We did distracted driving. So like texting, eating, putting makeup on, anything that's distracted driving, that's what we did. So we just set up a table. We had bottles of water because it's in Florida and it's like hot as hell. And we just set up a table, and whoever came, we just gave them the information. A lot of statistics. It was really easy. It was there was 4 of us, so all of our projects were group projects, and it was really easy. It wasn't hard at all. We also had a cultural project where we were given a specific culture. My culture was Islamic culture, and we had to like identify the differences of how we would interact with that patient via communication, religious beliefs, and whatnot. That was super easy too. We just used our fundamentals book and plugged things out of there and put things into scenarios to make sense. And then we had one more. I can't remember, but they were super easy. And to be honest, those are free points in my case. I thought they were just like points to get you to, you know, raise your grade a little bit. So in case it benefited me. And I'm not like scared of group projects or like standing in front of a room talking, less me being here talking to you guys. So yeah, group projects were a piece of cake. Let's see what else we have here. I got a 91 on my T's, and I studied with the ATI-TEAS secret. Yes, that's the book that I used. Good, congratulations. That's a great score that you guys had. I studied to pass. I didn't study to get a good grade. I am a horrible test taker. Like I am anxious the day before. I am anxious while I'm there. I'm anxious after. So I don't test well, and I think my anxiety has a lot to do with that. If you want more information on how I try to manage my anxiety, I can drop a video sometime in the next few weeks. But I studied to pass. I needed a 64, and I got a 78, so I was happy with that. But good, 91. Awesome, George. What apps do you recommend? Okay, so I have my phone here. Let me take a look. I don't really have any apps. I have the Quizlet app, which I use regularly. I have PhotoMath when I was doing math, and I have TEAS Genius. So TEAS Genius is an app, and it has like practice tests and things like that, just a bank. So I did that for my TEAS. And I also use for my fundamentals, there is a study guide. Let me get it. There was this study guide that came with my book bundle, and I really used this like my first 2 exams, and it really helped. And then I also used the Fundamentals of Success book. This really helped too. These are just questions, pure questions of different, like for instance, this is physical assessment. And then we have vitals in here, and then we have gastrointestinal system, oxygenation, nutrition. And these are just questions. And what I like about this book is that it has rationales so that when you answer the question and you're done and you're ready to check, it has the answer and it has rationales to why that particular answer is incorrect or correct. And I think that really helps you better understand concepts, because in fundamentals, what you need to understand is, sorry guys, putting all my books away. There's so many of them. What you need to do is you need to understand the concepts and how you would apply. It's not memorization. If you're a memorizer, you guys, get out of that habit now, because the only good thing memorizing is going to do for you is memorizing values. And that is it, because this is all application based. So you have the knowledge. Now, what are you going to do with that knowledge? How are you going to apply that to patient care and nursing diagnosis and all that good stuff? But they get you there. Don't be too scared. It's going to be okay. Just one day at a time. Okay, so what was the hardest class you had the first semester of nursing program, and how did you study for it? By far, fundamentals, because it's so full of content. This book here, I read every page. It's about 1,000 or 2,000 pages. I can't remember how many pages. I read every single page. When they say to read every single page, read every single page, please. Go take a small little sliver that's in the lower right-hand corner and make that into a test question. I read every page. While in lecture, I did not take any notes. All I did was whatever chapter that we were working on. Okay, so let's see. Let's do vital signs, because vital signs were like my nemesis as far as skill checkoff was concerned. Okay, so what I did is I would open up the chapter. Here's the vital signs chapter, okay? And as they were going through the chapter, I would highlight what they said. So they literally verbatim said, frequency of assessing vitals is to determine individuals of each patient, and it's dependent on patient status. If they said that, I highlighted it. And I did that for every lecture. As you can see, it's very well loved for every lecture. And then when I was ready to study, I went back. I read everything that I highlighted. And then I used that Fundamentals of Success book to go back and review. And if I felt like I was still weak, I would go back to this book and look at where I was conflicted as far as why I couldn't understand the concept. Does that make sense? Skills was easy for me, except for vital signs. And that is a story time. I almost failed nursing school, you guys. It is possible to fail nursing school. It is more real than you think it is. And you really need to put the work in. I'm telling you, I studied 30 to 40 hours a week, in addition to going to class and clinicals and having a family. So it is very time consuming. It is very difficult sometimes. And you just need to stay focused and find what works for you, because what works for me may not work for you. I had to adjust my study habits quite a lot according to how our professors wanted us to answer questions. And I may have to do that next semester too, because I have a whole new set of teachers and professors. So I don't know how they're going to be asking us questions. They say it's NCLEX style, but there's so many different styles of NCLEX style that it's always evolving and changing how you study based on how your professors want you to answer questions. Okay, next question said, Naomi said, how were you tested on vitals and physical assessment? Okay, so 1 day a week in my class, they show us the skill in front of the class, okay? We're divided up into certain groups, and we had 4 lab assistants or professors that would pull us into groups of 10. I had a class of 40. My cohort was 120. And they would pull us into lab rooms or simulation rooms where they had patients, dummies, that were laying in beds, just like a hospital setting. And then they would show us the skill. So for physical assessment, they just used one of us, and they said, okay, this is the reason why we do physical assessment. This is what you're looking for. These are the abnormalities, and they walked us through it. So for instance, the way I do my physical assessment, you have to do your critical elements. So make sure you do critical elements. Critical elements is identifying the patient, asking pain, asking if they're allergic to anything, and privacy. So make sure you do that. So for instance, when I walk into a room, I knock because we want to make sure that we are courteous to their privacy, and introduce myself. I pull my curtain or close the door, and I say why I'm there, my name. If I have an order for something, I keep my patient very informed and say, hey, I have, my name is America. I'm going to be your student nurse today. I have an order for physical assessment, and what this is going to do is give us a baseline of how your, current health status is. I will have my hands on you. I'm going to be using my stethoscope. I'm going to be listening to your lungs and heart and your bowels. But before we begin, let me assess your pain, 0 to 10 on a pain scale. How's your pain? If they had pain, where is it? When did it start? How long have you had the pain? What type of pain? Throbbing? All this information you're trying to gather to have a baseline. And then you would ask, are you allergic to anything? Latex, because if you're going to be using gloves, if this person has excessive diarrhea, you don't want to get diarrhea on you, or is vomiting profusely, you don't want to get all that yuckiness all over you. So if you're going to be using gloves, are you allergic to latex, medication, environmental, food, any of that stuff? And then you ask for permission. May I go ahead and proceed? And then as I'm going down, I start from head to toe. As I'm going down the body, I just say, okay, I'm just going to go ahead and take a look at your scalp, at your ears. Does anything hurt? How's your hearing? Asking them questions about their health status. Asking them, when did they last eat or had a bowel movement, all that good stuff. But they're going to show you, your skills teachers and professors are going to show you how to do a physical assessment. And once I went through that skill, what I did was I took a notebook similar to this, and I wrote down step by step how I was going to perform the physical assessment. And I lived in the lab. They have a practice lab, and I lived in that lab. And I practiced and practiced and took my friends, my nursing friends, and we practiced on each other over and over and over and over and over again. Because for certain skills, you have to be very precise. So for instance, when you are assessing the heart, you have certain points on the chest that you need to check. For instance, the second intercostal aortic, I'm probably doing this wrong, center intercostal aortic, second intercostal pulmonic, third intercostal, second pulmonic, and then down here under lube, right here, you have your apical pulse. And we had to listen to the apical pulse with our stethoscope for 1 minute, and we had to be spot on as far as the numbers concerned as to how many beats per minute. And that scared the hell out of me because it was so scary. I was like, oh my God. And I was the first one to go. And the girl that I had for physical assessment, she naturally had a fast heartbeat. So I was like, boom, 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 boom. It was like 102 beats per minute. I was freaking out. Thank you for me. I like my shirt. I made it. What do you guys think? Thank you. So yeah, it was a very humbling experience because although I practiced, you just never know who you're going to be assigned to do physical assessment on. So I recommend getting the person who has the fastest heartbeat in your group because you have to be able to count apical pulses. It's very vital, and you have to be able to listen to lungs and know where the rib cage is. And I promise it sounds really hard, but once you start practicing and practicing and practicing, it is okay. Like, you will get it, I promise. I have a physical assessment video of how I do it on my channel. I'll link it below once this video is up and not live anymore. And then I may do a vitals one for you guys. But remember, your teacher may teach it differently. So do how they want to do it, and then you can modify it later when you are practicing. Okay, next question. Would this video be on? Yes, this video will be on my channel later. How was your first clinical experience like? Okay, so my first clinical experience, I was at a smaller, the smallest out of the 4, rest home or like a memory care facility, and where people go, unfortunately, to live out the rest of their lives, so retirement home. I had a CNA that day who was not very receptive to me being there. She just kind of like pushed me away, like, can you go get water for this patient? Can you go check on that call light? I mean, I really wanted to like shadow her, like be her shadow, and she kind of just was like, just go do these little things that I don't want to do. So I did them, So I was there to help. I was there to be a lending hand, and that's what I did. It can be very intimidating. I am not a very shy person. That's me being a YouTuber, and that's who I am. I'm not very shy. So I was very proactive. I was assigned to a unit, and then the way that the units are set up, they were hallways. So I was crossing units. I was going to every call light that there was. If no one was answering, I was there. I was looking at patient charts and things like that, and I was trying to just immerse myself in however I could, even though my CNA was kind of just like, leave me alone, let me do my own thing. That's the impression that I got. Hopefully that you'll have something different. And so I just did what I could do when I could do it, and just try to not be in her way, but kind of be in her way to where she would give me tasks. And it's just really a learning experience. You have to see how your CNA is or your LPN is, see if they're receptive to education. If they are, amazing. If they're not, just do your best to learn as much as you can while you're there. Okay, next thing. Is it harder to find a pulse on someone bigger? From my experience, no. Because where you're looking for pulses, you're looking for a pulse here. And then you're looking at the brachial, and then you're looking at the radial, and then you're working your way down the body. The apical, if they are bigger chested, you do have to lift up the boob and put it like really up high. So if someone is big busted, that can be a little difficult, but once you find it, it's good. And then you can continue to go down the body, and you do the, let me see, you do your, I hate listen. Okay, so I'm going to try to bring this down a little bit. Okay. So you do your radial, and then you do femoral pulses. So if someone has like a bigger abdomen, it can be a little harder to find the femoral pulse. And then you do the popliteal pulses, which are back here, and then you do your feet on your pulses on your feet. There's 2 here. And it just takes practice, really. And that's what labs for. Labs are for practice. Practice on all shapes and sizes. Don't discriminate. But I found it really easy. Once you find it and you know the locations, it's not that hard. Yeah, it was fine. Just the apical for bustier women was a little difficult, but once I found it, it was very loud and I could hear it just fine. Okay, yay, I made it. Just got home from school. Hi, Candace. Welcome. Okay, so do you guys want to see what's in my backpack and what I use as far as supplies is concerned? I just went shopping for supplies. This is my book from last semester, which I'm going to store away unless I need it. And then this drug guide we use all the time. And then this is my dosage calculations book. I do have dosage videos on my channel if you guys want to learn how to do that. And this semester, I'm doing med-surg. And take a look at this baby. This is my med-surg book. I haven't even opened it yet because I'm so intimidated. But this is what we're going to be learning. I'm just so scared to open this book that I'm just going to leave it there. And hopefully they'll give us PowerPoints because I don't think I can read all that. Okay, so let's go. Let's do my backpack. Okay, so my backpack that I use is a rolling backpack. I learned the hard way. I used just a JanSport backpack before, for about 2 weeks, and I was like, oh, hell no. There's no way that I'm going to be carrying these books all over the place. So I haven't opened this since the semester started, so I don't know what's in here. Okay, so I have lipstick and a highlighter. And then this backpack. I love this backpack because it has so many like compartments. I just have little sticky notes, another highlighter, Band-Aids because I have to cover my tattoo, which is here. And then in this pocket here, I just have a bunch of papers. Let's see, this is my nursing schedule for next semester. I have a little ladies, pocket here for any emergencies, some note cards, and some Post-its. This is what I use during my clinicals because we were assigned a patient's case study and we had to, for instance, find the pathophysiology for a certain disease. This person had, let me see, she had COPD, which is a gas exchange issue, and I had to list what medication she was on, things like that. So I just wrote all my notes on this little book here, and then when I got home, I was able to organize it okay. And then this is, oh, I love these things. These are IPRs. This is like a communication type of exercise that you use when you're communicating. It's just, they want you to use open-ended questions and try to get as much information from the patient as possible while you're there. And then, what else do I have in here? Okay, so in here, I have, this is my testing folder. This is my friend gave me this. She's so sweet. This is my testing folder. So for exams, we cannot take anything with us. We have to take only a pen, calculator. I have tissues in here because I was crying that I was going to fail. My school ID, pencils. So whenever I have an exam, I just take this because we can't take anything else with us. And then, hold on a second. A window popped up here. And then in here, these are just some case studies I had to work on. Lots of writing, you guys. Get ready to write your tails off. And then this is my conceptual map. That's where these case studies came from. And then I had 2 of these spiral notebooks. One was for lab, and the other one was for lecture. But like I said, I didn't take any lecture notes. I just highlighted. And then in here, I have all of my pens, highlighters, all that good stuff. It's just a pocket with just tons of colorful things that make me happy. And what else do I have in here? I have, this is my other binder that I use for lecture and things like that. And then here is my school binder. I'm going to put this down now because this is too big. This is the binder that I'm going to be using throughout my entire nursing career because Mama's on a budget. I put whatever calendar month I'm in the front. That way I know what I have going on, what's due, and I cross it off as we go. And then I'll bring this down a little bit. And then in here, this is my planner. I wrote everything I needed in there based on when it was due. But, and I used it for 2 weeks. But then I found that I was scared that I was missing something. So all I did was I discontinued using this. And I just took my calendar. And as I finished a task, I just crossed it off. Because it made it easy. It was no fuss. And then I just sorted in here if I needed to know, hey, do I have to wear uniform today or not? And then I had just paper. So I just wrote whatever notes that they said, be early here or whatever. And then I have dividers. My first divider is my dosage. So these are just common dosage calculation conversions. And then I divided it into exams, but we didn't take any notes, really. So that kind of went to hell. And then I used these folders here. And what I did was I used this folder for old calendars and then my skills checkoffs. All my skill checkoffs are here. Just saying I'm proficient in the skill. And then this one here is my exam, and this is PPE skill. And then these are just some fundamentals questions, or some practice questions. And then in here is any like library sources or how to like decipher questions, some testing strategies. And then in here I have dosage exam and review. So that's just how I've organized. My professor for this next semester organizes his binders differently. We're going to be organizing based on the week. So I'm going to be cleaning this out and putting all my dividers in based on week. So that is what I currently have in my possession as far as supplies are concerned. I did go shopping for supplies because I felt like I needed things. You need one of these. Run, go get them. You need a little mini stapler, so I bought a mini stapler. I got more highlighters because I'm telling you, I went through like 4 of these. They dried up so quickly. And then I got basic calculator. So you cannot use scientific calculator. You can't use a fancy calculator. You can't use a calculator on your watch or on your phone. It has to be a basic 10-key calculator. And these were literally $1. So I got 2 of those. And then I got a binder just in case here. And then I just got some filler stuff. So I got some more dividers. I got 2 one subject notebooks. I got some filler paper. And then I just got some of these 3-prong folders. I'm not sure what I'm going to do with them yet. I'm going to fill out the class and see how I'm going to organize things. Just finding my mojo and how I'm going to organize stuff. That's what I'm probably going to do the first 2 weeks, and then stick with what works. So remember, what I do may be differently from what you do and what your program requires, so take that into consideration. And then I have my lab bag here. You guys want to see what's in my lab bag from Fundamentals? Let me know. Thumbs up, let me know if you want to see the lab bag. There's a lot of stuff in there, so I don't want to. Yes? Okay, so I'll show you what's in my lab bag. Okay. So this baby cost me, I don't know, like $165, and it came with everything that was in my lab kit. And it came with this duffel bag. So when you open it up, it's a mess because I haven't cleaned it out. This was my catheter kit. So this was sealed, but I had to use it for a skill. So it's just a Foley catheter kit. This is what it looks like. That's what a Foley kit looks like. It has just the bag down there. So this is sterile, so you're going to learn how to do sterile techniques, sterile gloving. If you want a video on how to do sterile gloving, how I do it, let me know in the comments and I'll get that out for you. It can be very tricky, but once you find a method, it's not that hard. But you have to be careful because they'll fail you if you don't do sterile techniques. All right, the next things I have in here are tons of sterile gloves, and I'm a size medium. And then I have in here a hazard bag. In here I did all my wound care stuff. So they give you AED pads, they give you gauzes, everything to perform a sterile wound cleaning. They give you one of these to measure the wound. A bunch of stuff in there. And then I have some more gauze pads for wounds. And then I have alcohol wipes because you use these every time you see a patient. You use them every time you use your stethoscope or your pulse ox meter. And I have 2 of these, what are these called? Pen lights. This is a must, you guys. Get to moving, please. I have a pair of bandage scissors. I have this little pocket thing, but to be honest with you, I haven't used it. Because we're not doing like anything invasive in nursing 1. We were just doing like physical assessment and vitals, so I haven't used this yet. Hopefully I can use it next semester. This is a condom catheter. This is for our males. It is literally a catheter that is like a condom, and they can pee into like a Foley bag. And then I have in here, these are all of my syringes that we use for practicing how to administer drugs via shots. These are insulin syringes. It has like a safety cap. These are more like needle tops, more 1 mil, no, these are 3 mil syringes, and just a bunch of needles and things like that, depending on what kind of shot you're going to be administering. And then I have my PPE bag. This will be one of the first skills that you learn, how to put on PPE in a specific order. This is the gown, the mask, the gloves. And then I have, what is this? I have a Nerf bullet in my bag. My son probably. Here is more gauzes and more sterile gloving. I can show you guys how to do sterile gloving real quick. If you guys want to see, let me know. I'll leave that there just in case. And more stuff to measure wounds. And then here we have, this is for, what are those things called? They're for stomas. This is what you use to put around the stoma, and then you put a collection bag for people who have stomas in their intestines to get rid of poop. And then that's it. I just have some papers in here from Concept. Oh no, this is drugs portfolio. I gotta put that somewhere. Safe. And then they gave us a pen. I don't know why they gave us a pen. They gave us a pen. So that's all that is in my Nursing 1 kit. In my Nursing 2 kit, we're going to be having some more goodies. And I'll do a unboxing of all my Nursing 2 stuff if you guys want to see that. Once I get it, I should be getting it in the next 2 weeks or so. So yeah. So that is my bag, but since you guys are here, I wanted to do a little giveaway. This is a badge reel. We have to use our badges all the time, and I wanted to give this away to somebody. So if you are subscribed to my channel, and if you go to my Instagram, the SassyMom82, and post on the Q&A thumbnail picture there, leaving me what type of videos you guys want to see, I will choose a random winner by the end of tomorrow. So yeah, it's pretty cool. It's one of those, you know, all day I'm doing this. And it's, you just hook it on, you can put it on here like that, and this is a mess. So go to my channel, subscribe, click that notification bell, go to my Instagram, the SassyMom82, and make sure you follow me there. And so yeah, good luck, you guys. What else do you guys want to know? Ask me more questions. You want to see sterile gloving? How I do sterile gloving? Okay. Wow, I haven't done this in a while. Let's see. Okay. So when you do sterile gloving, you take it out of the package, okay? So when you open the package, you have a 1-inch border around your package that you can touch, okay? So what I like to do is I like to really open up these creases like this, okay? It's out of the way. So many books, so many books. All right, so I really open up these creases because they'll fall back on you if you're not careful. And then you take your hands, you unglove, okay? So now you can touch any 1 inch. They say 1 inch border, so I'm like, okay, 1/2 inch border. That's what I'm going to be using. And you're going to glove your dominant hand first. So I'm a righty. So what I'm going to do is I'm just going to, anything on this cuff you can touch, but the least you touch, the better. So what I'm going to do is I'm going to pick up, let's see, these are both the same way. So I'm going to pick up the glove, flip it, okay? And I'm going to step back, and then I'm going to slide my hand in the glove and pull. Now, I'm going to leave my hands waist or higher. This is a must. If you drop anything lower, you are unsterile. Now what you can do, this is a sterile glove, so technically you can touch anywhere, but the least we touch, the better. I'm going to take my four fingers, leaving my thumb out. I don't know why they do that, but they want you to leave your thumb out. And then I'm going to go ahead and take my left hand, and we're going to go ahead and pull through. Bam, sterile gloving. Now you can adjust. You can go ahead and adjust, and you're sterile, but make sure you don't go above or below the waist, okay? No below the waist. Once you go below the waist, you're considered unsterile. So what I like to do is I just like to hold my hands like this, or dinosaur hands like this, literally dinosaur hands. So that's how you do sterile gloving. And then just to take them off, you're going to pinch here, okay? And then you're going to take your another one underneath, because you don't want to contaminate yourself with anything here, right? So, hold on. I'm getting a phone call. And then you're just going to fold the other glove into itself. It would go like this. And then you just go ahead and discard. So that's how you do sterile gloving. Any other questions, you guys, before I leave? Time management. Learn how to time manage. I have some notes here. Let's see. Okay. Nursing school is harder than you imagine. Trust me. This is one of the hardest things that I've ever done in my life. But I'm doing it. I don't have another option. I'm doing it. And I'm going to continue doing it until they tell me not to be honest with you. When they tell you to read every chapter, just do it. I know it's a lot. What I do is on my calendar, so this is my calendar for next semester. This is everything that I have going on for next semester. I would read based on the calendar the day before. So if it said read chapter 3, 4, 5, I would read chapter 3, 4, 5 the day before. Or however many days I have leading up to that chapter. Just to stay on top of things, because fundamentals is so heavy. So heavy in material that they're just like pounding you with stuff. So they say to read. You're going to cry, and that's okay. I cried several times. I'm a relatively strong personality, so giving in to my emotions was difficult for me. I had probably like 2 breakdowns. And at one point I was like, is this really for me? Like, can I really do this? And I did. I passed, so you can too. Let's see. When they tell you shouldn't have a job while in nursing school, it's true. I know some people have to have a job, and you will do it. You'll manage. You'll find a way. It's just going to be a little more difficult time managing. Just make sure you are very detailed in your time management skills. Have a calendar. Stick to it. Be very organized, and you'll be okay. For me, I cannot work while doing this. I just can't. It's just too much. You will fail. You will fail an exam or a test or a quiz, and that's okay. Pick yourself up. Just get back. Learn from it. Move on. Don't dwell on it. It's okay. You're going to start to study harder and longer than you ever have. Yes, I study 30 to 40 hours a week in addition to instruction days and clinical days. So it's you just got to put the work in. There's only certain people that can be nurses, and you just got to do the work. If you were an A student before, you're probably not going to be an A student. Probably good chance that you might not be an A student in nursing school. B student, yeah, C student, that's me. So all I need to do is pass. That's all I need to do. I need to get a 77 or better. That's my school's criteria. And as long as I stay above 77, I'm okay with that. Because I know that I know what I'm doing. It's just I don't test well. That's all. I know what I'm doing. So yeah, any other questions before I leave? Let me know. I struggle with math. Can you do a video on how to do well in math? What exactly do you struggle with there? Are you struggling with like dosage or just math in general? Let me know. I have a few dosage videos on my YouTube channel now on how to do dimensional analysis for dosage. I hated math. I got a C- in college algebra. I just needed to pass, and I did. Algebra was not my thing. Math and numbers is not my thing. People is my thing. But I did ace my dosage exam, so I can do more videos if you'd like. What else? I'm here to say that Donald Trump is a true American legend, icon, inspiration, and hero. Okay, whatever you say, Trump supporter. We don't do politics here, so bye, Felicia. You would love to see a second video unboxing. Okay, so as soon as I get my lab kit, I will make sure to do that. And my next semester, it's going to be jam-packed, you guys. I start on the 27th. My first day is 6:30 to 6:30, and I have a dosage exam, and yeah, I have a lot to do next semester. So let me see, math in general, and I cannot even think about dosage. Yes, dosage would be great. Okay, so math in general, I can't really help you with that. I don't know what you're looking for. Math is so big. There's such a big umbrella of math. Dosage is actually a lot easier than math. I don't know why. It's very straightforward. You just have to decipher the necessary information out of the problem. As far as general math is concerned, there's lots of videos on YouTube about general math. I don't know what classes you're taking in order to apply to the program. I had to have just a math class, and I had to take college algebra, and like I said, I got a C in that. Most people who do well in math don't do very well in dosage, and flip-flops. So the people who don't do well in regular math do very well in dosage. I don't know why. I do very well in dosage. It's really multiplication. That's all it really is. Multiplication, division is basic. It's really not that hard. I have to take college algebra. So I took college algebra online, which was probably the biggest mistake because it was self-taught. And I knew math was going to be really difficult, but I was working a full-time job, so I had to take the online class. But thank God my husband is really good in math, and he helped me tremendously. And my oldest daughter, she's really good in math too, so they helped me tremendously. But you're not going to be using algebra in dosage, so just pass the class. You'll be okay. Worry about the dosage later. It's really easy. It's not hard. It's just pulling information that is needed. Sometimes they put fluff in the stuff that is not needed. And you just got to find out what is and what isn't. It's not that hard, I promise. You're welcome, Vera. So I guess that is it, you guys. If you don't have any more questions for me, I'm going to go eat some lunch. I'm starving. Don't forget to subscribe if you want to win one of these. We've got 2 of them. If you want to win one of these, you know what to do. Subscribe to my channel. Did I explain this to you guys before you came? So this is my coffee mug. This is my nursing coffee mug. In nursing school, you have to learn abbreviations, and these are common abbreviations that you're going to learn. So caffeine, I am a coffee addict. I love coffee. PO means by mouth. Q4H means 4 times a day, right? No, 4 times Q, 4 times an hour. I can't remember. And PRN is as needed. So this is my coffee mug, and this is my shirt. I hope you guys like it. I'm going to wear it for the first day of school. On the 27th. And yeah, so I guess that is it, you guys. Thanks for joining me. If you want me to do more YouTube lives, let me know in the comments. And I think that is it. I have a mess of lab stuff on my bed right now. That's okay. It is okay. I wish you guys all the luck in the world. It's going to be hard. You can do it. You can do it. Yes, I got you. Oh, I forgot to tell you guys. I created a Facebook page just for nursing students. It is called Student Nurse Support Group. I think that's what it's called. Let me see. Hold on. Student Nurse Support Group. Anyways, I'll link it down below. It's a Facebook group page that I created just today to kind of build a community of student nurses and nurses, and just to feed off of each other, positive affirmations, and just a positive place where we can share each other's ideas and struggles and all that good stuff. So make sure you go to that page and join. I'll link everything below. Give me about half an hour or so to link it all below, and then you can come back to the video description box and click on that. I'm going to have some merch available if you guys are interested in shirts and stuff like this. I'll leave it in the link below as well. What else? I think that's it. Yeah. I think that's it, you guys. I'm going to go have me some lunch. I hope you guys have an amazing weekend. I am vlogging this weekend, so make sure you join the family. I include beauty. I'm a plus size beautiful woman, as are all of you. So I do some fashion, I do family vlogs, and I do my nursing vlogs. So make sure you subscribe, say well, and thanks so much for joining me, guys. I will see you in my next one. Mwah!